Good evening, everyone, and welcome to Let's Talk. I am so excited for tonight's Health Pros Live. This is going to be something special. My name is Dr. Mike Mills, and it is my privilege to just guide us through a conversation tonight on how we can continue to optimize our health and well-being. I know for some of you, this may be the first day on program, and if that's the case, congratulations to you. You are in for an amazing journey. And some of you may have been with us for a decade or more. And there is always something for us to learn. Optimizing our health is something that never ends. So 7 years ago, my wife and I experienced an amazing transformation from our Optavia program and truly reset our metabolism and our metabolic health and really changed our life. And our family is the reason why we do all of this, so we can create more experiences and memories with them. And so tonight I get to introduce you to two fellow health coaches and amazing physicians. First is Dr. D. Garcia. Dr. Garcia has been a board certified oncologist for many years. She's practiced medicine for over 30 years. She's a leading expert in breast cancer and is one of the founders of the St. Louis Cancer and Breast Institute. Dr. Michael Smith is board certified in internal medicine, and he is the previous chief medical director of WebMD. So, last week, Michael, you had the opportunity to be part of the metabolic masterclass that Jared and Amber took us through. And what an amazing presentation. If you guys haven't had a chance to see that, please go back and watch that. Metabolic health is something that's impacting our country in a major way. 9 out of 10 adults in America, they say, now have metabolic dysfunction of some kind, meaning that the way that their body processes their food and turns it into energy in their body is not functioning properly, leading to high blood pressure, changes in triglycerides, blood sugar, low HDL, increased waist circumference. But these are kind of big terms. I know we sit around family functions and we hear people talk about these things, but um, Dr. Smith, I think it would be great if you could maybe bring that into context for people of what does metabolic health really mean to us in our day-to-day lives?
Yeah, I mean, you really hit the nail on the head. Truly, it just boils down to, if you can think way back to the little science class about hearing about little mitochondria in your cells, literally, those are the powerhouses of your cells, your entire body. When you have metabolic dysfunction, which you point out almost everybody does, that's kind of the bad news. We'll get to the good news shortly, but when you have that, those little mitochondria just are not able to produce the energy that they should, and it comes out in all kinds of crazy ways. Inflammation, like joint pain, fatigue. There's like an epidemic of fatigue in this country. And a lot of it is actually driven by metabolic dysfunction. I'll tell you 2 seconds real quick. I have an autoimmune condition. I don't even think I put two and two together, but I realized today my symptoms were largely driven by metabolic dysfunction, and I didn't even have any weight to lose, which many people with metabolic dysfunction don't. So that is really such an important point, but we have control, and I know we're going to get into that in just a little bit.
Yeah, it is. It is something that's impacting so many people. Dr. Garcia, I know that from an oncology standpoint, how does this metabolic dysfunction that's affecting so many Americans, how does that relate to our risk of cancer and other chronic diseases?
Yeah, well, there are a number of reasons why people that suffer from metabolic dysfunction, metabolic syndrome, there are different terms for it, um, are predisposed to cancer. So, one reason is because metabolic dysfunction results in inflammation. And so that predisposes us to certain cancers. But also, people that struggle with weight, which is one of the symptoms of metabolic dysfunction, have higher circulating estrogen levels. And that's super important for women. As a breast oncologist, it was something that I became obsessed with. And the reason why is over time, I saw younger and younger women with breast cancer. Many of them were overweight, certainly some of them were obese. And so, what happens with increased body weight is we're increasing our risk of breast cancer, but also cancers of the uterus and of the ovary. And so, achieving a healthy weight, reversing that metabolic dysfunction significantly decreases the risk of breast cancer and some of the other cancers as well. In men um, and in women, insulin resistance, which is one of the manifestations of metabolic syndrome, increases the risk of cancers of the stomach, of the colon and rectum, the liver, um, pancreas, gallbladder, kidney, esophagus, stomach. I mean, it's just a huge number of cancers related to these conditions.
Yeah. Wow. You know, it just helps us to really see the impact that this has on all aspects of our life, and brings into context that really the weight gain is a side effect of the underlying metabolic dysfunction that's happening. But Dr. Smith, as you mentioned earlier, there is a brighter side to this, right? And we're specifically talking about Optavia tonight, and the impacts that we get to see this have on people's lives. But let's talk about reversibility of metabolic dysfunction, and is that possible?
100%. And you say we're here talking about Optavia, but it's with good reason, guys. So if your doctor ever tells you you have metabolic dysfunction, and probably they won't, they'll tell you you have diabetes, you have the consequences of having metabolic dysfunction for many years. But the thing is that the unfortunate reality is, and I say this as a doctor, they can't really do anything to help you turn that around, because what turns it around is healthy habits. What is Optavia about? Healthy habits. And we know, proven from clinical studies, that Optavia can reverse metabolic dysfunction. So what does that mean? That you have something in your hands. I feel like I'm kind of preaching to the choir. You guys are here, you get it. But you have something in your hands that can just so significantly impact your health and the health of all your loved ones. 9 out of 10 of us have it, but we absolutely have control when we make the changes that are consistent with the Optavia lifestyle very quickly, actually. We know for sure in weeks to months, and I would say within days, your body starts experiencing the positive improvements and that metabolic dysfunction starts reversing.
Yeah, that um, it's just truly amazing. I mean, we are here, but I think it's great that you share that with us because maybe you showed up here and you just were focused on you know losing some excess weight, and hopefully by the time you leave here today, you realize that that is an important goal, but there are so many more things happening in your body that are so profound. I know, Dr. Garcia, when we were talking the other day, you shared a story of a client that was just an amazing example of how this reversibility is possible.
Yeah, and one of the things I wanted to say about whether it's diabetes or high blood pressure or other medical conditions related to our unhealthy metabolic state is I am always astounded by how many people don't know, for instance, that diabetes can be reversed. And many times they don't know because their primary care doctor doesn't tell them that. And I think that the reason that sometimes mainstream medicine doesn't put some of these things out there is because they've seen so many patients that come in and you give them some advice. You got to lose some weight, become more active, eat healthier, blah, blah, blah. They give them general advice in those 15 minutes,
Mhm.
and they don't believe that those patients will ever accomplish that, because they usually don't. And so when I work with people, or when I encounter people and I tell them that diabetes can be reversed, many of them are just so surprised. So I want to share a story about a client named Jeff. So Jeff was 47 years old when I first met him. He was 295 pounds. He's 5'10", so not very tall. And he had really severe heart disease. His ejection fraction was only 22%. A normal ejection fraction is 55 to 70%. So kind of like heart transplant material, except that he was in too bad a shape to ever get on a heart transplant list. He had diabetes, high blood pressure, restless leg syndrome, you name it, Jeff had it. His cardiologist had told him that he was at severely high risk for a heart attack. So basically, Jeff was on the sofa in his own home for 3 years. Um, his doctor finally talked to him about gastric bypass, and Jeff said, "I'm not doing gastric bypass. I just won't consider that." He said, "Instead, I'm going to reach out to someone I met on Facebook who has another program." The doctor was kind of negative, said, "Well, it's probably not going to work, but come back in 6 months. If you haven't improved, I'm going to send you to the bariatric surgery person." In 6 months on Optavia, Jeff lost 90 pounds in 6 months. Not everyone's able to accomplish that, but he was extremely motivated. And in those 6 months, he was able to eliminate 14 prescription drugs. He was on 18. He eliminated 14, and his prescription drug co-pays dropped from $1,100 a month to $25 a month. Jeff got off the sofa. He built an addition on his house. He was up on the roof doing his own roofing, whereas before he was on the sofa, with angina.
Yeah.
So that is like a dramatic story. But those of us that have been doing Optavia, we see people like this.
Yeah. Yeah. So amazing. And those, I think there was just so many of those stories out there. And maybe you're here tonight and your focus is on your own health, but maybe some of these stories are connecting you with friends and family in your life that wow, they're being challenged by some of these metabolic dysfunctions as well. And now you have an opportunity to connect them with someone that can help them find relief. One of the questions that I saw earlier, that there's a massive increase in our country of non-alcoholic fatty liver syndrome, a lot of times referred to as NASH. And I know that your specialty, Dr. Smith, is in internal medicine. I hear this a lot, even in my own family, the cases of people, going to the doctor and finding out they have fatty liver. Maybe you could bring that into terms of what does that mean to us, and what's possible if we receive that diagnosis.
I'm so glad we're talking about this, because I don't even think a lot of doctors truly understand the impact when they tell someone they have fatty liver. It is one of the biggest signs of metabolic dysfunction, and about 1 in 3 adults has fatty liver. But here's the problem. Most don't even know it. It's a silent disease. It has no symptoms until it's advanced. And the point is, when it is that advanced, there's not much that can be done once you've started developing cirrhosis. But there is a lot you can do, even though I wish I could take a poll. You know how many FDA approved medications there are for fatty liver disease? Zero. Because there's really, again, medically nothing that can be done. But it is just like metabolic dysfunction, you can reverse fatty liver through making good habits of health changes. And it's not just what we eat, it's how we sleep, it's how active we are, it is how we manage stress, which can lead to cortisol levels and inflammation. All of this impacts our risk of metabolic dysfunction and fatty liver disease. One of the really sad things is that we see it more and more in kids. About 1 in 10 children has fatty liver. And if you look at kids who have, weight challenges, the percentage is even higher. I want to share one important point, though. It's not just a weight-related disease. In fact, I think about 40% of people who have fatty liver disease appear to be thin, but they have higher levels of fat. They carry around higher levels of fat internally. And why that is so important is because, and we were talking about this the other day, is GLPs can be such an incredible tool to help in this journey, but they alone also can't reverse metabolic disease, metabolic dysfunction, or fatty liver disease. You really need to focus on the healthy habits. And unfortunately, the medical community just doesn't help you, but your coach absolutely can.
Yeah. And I know, as we discussed the other day, the earlier we start to intervene with our lifestyle, the more of an impact we can have. And isn't it amazing that Dr. A gave us all of these macro habits of health that address all those areas that you were just talking about, Dr. Smith, as it relates to sleep and movement and stress management. We don't just have a nutritional component, we have a holistic lifestyle approach. Dr. Garcia, I saw some people asking in the chat related to how early are we starting to see these metabolic dysfunction signs starting to happen with people. And I know that's something we talked about too.
Yeah, it can happen at a very young age. In fact, I was at a party last weekend, and there was a couple there. He was a former football player. They were probably in their early 50s, and he had been inducted into the Hall of Fame. This was for college football. And so a lot of people were attracted to this guy, going up and having conversation. He and his wife were extremely overweight, probably each of them at least 200 pounds. And so I struck up a conversation with them, just getting to know them better, certainly not telling them what I did. It wasn't appropriate in this setting. But they were talking about their granddaughter, and their granddaughter, 4 years old. And the woman said, she just doesn't eat anything. And so I just asked a few questions. I said, well, what are you feeding? Well, she doesn't like Cheetos, and she didn't like Doritos, and she didn't like the barbecued potato chips. And I found that she would eat a few of the plain potato chip, but there was no mention of anything healthy at all. And back to, people don't know that diabetes can be reversed. Many people, they also don't know that you can prevent you can prevent like a whole slew of medical problems by learning to, or teaching your children to eat properly at a healthy age, and changing your own diet. So Michael talked about all of the, with our Optavia program, all of our lifestyle habits that we coach people on, movement and sleep and stress reduction and hydration with water. But the healthy eating is just so important, nourishing your body throughout the day so that we can prevent the early start of this slipping into metabolic, issues.
Yeah. You know, I think one of the things that may be interesting too, just to talk about tonight, is that how, as physicians, you guys were led to Optavia and why you've chosen this approach. I mean, there's some people probably listening to this tonight thinking, why take this approach? What is it about this approach that um, you know drew you to use this as your way of helping people to reduce the risk of metabolic dysfunction and reverse it? So, Dr. Smith, maybe that would be something that I think that everybody would enjoy learning more about.
Sure, yeah. I was just thinking a little bit ago that granted, I was in medical school a long time ago, and maybe they learn about it more today, but honestly, metabolic dysfunction really wasn't a term that we learned about. I've learned almost everything I know because once I started getting more into the whole area of wellness and prevention, and that's really why I looked at Optavia and realized for me, kind of the stars aligned with I had forever wanted to help people and I had the knowledge and I was sharing. I became a personal trainer. Like I was acquiring knowledge, but I never really seemed to be able to put it all together to actually help someone make the not the short-term changes, because we can always do something short-term. It's really about that long-term change to create this lifelong health. Like losing 90 pounds like Dr. Garcia was talking about is phenomenal, but keeping that 90 pounds off, that is where you truly realize we have something different in our hands. And that's what it was for me. Early on, I was watching people, I knew people on Optavia, I started looking at them. They were not just losing weight, you could just tell their body composition was changing. They were losing body fat. And we know from our studies preserve 98%, our program preserves 98%. And we know that from clinical studies, which is really in the world of weight loss is unheard of. So just know that. But that's really why I chose Optavia, because I wasn't interested in short-term changes. I was interested in long-term lifestyle changes, and that's what we focus on. And that's why I would just encourage anybody, especially if you're early on, you haven't quite put it all together. You might just be focusing on fueling your body, and that's it. But as you get a little bit further down the road and you start having more energy, you start getting more active, you realize the brain fog is going away, you start sleeping better, and then one thing leads to the other, and just take it all in for what this program, this lifestyle can really do for you. Because that's exactly why almost, well, just over 11 years later, I still believe in it so strongly.
Yeah, beautiful. That's awesome. Dr. Garcia?
Yeah, and so how I got started, so when I first started practicing my specialty of breast cancer, there were about 60,000 new cases of breast cancer diagnosed in the United States every year. Fast forward to today, 280,000 new cases of breast cancer every day. So how did we get from 60,000 a year to 280,000? From all of these things that we've been talking about tonight, unhealthy habits, the weight gain, the estrogen dominance, and all of that. And over the first 10 years of my practice, I saw women go from, you know, primarily being my age, 50s and older, to 40, 30, even women in their 20s. My youngest patient was 18 and she was about 100 pounds overweight. Not that that was the only factor in an 18-year-old because she was so young, but I became obsessed, and I'm not exaggerating when I say obsessed. I became obsessed with my young patients because they would come in with their mothers, the grandmothers, holding the toddlers and the babies and the children of grade school age in the waiting room. And I knew that, all day long we could do surgery, chemo, radiation, whatever they needed. But at the end of the day, if they didn't learn healthy eating and get their weight off after they finished their therapy, then they were going to come back to my office with a recurrence or another cancer or something else that was weight related. And so I wanted to keep those moms healthy so that not only were they cured of their cancer, but they were around to raise their own children. Um, and breast cancer has a very, high survival rate. compared to other cancers. But even, me losing one patient or 10 was just heartbreaking.
Yeah.
That's how I became involved with Optavia.
Well, it's just amazing, and I think maybe one of the biggest takeaways that we can all take away from this evening is the power of our choices. That we do have the ability to influence our health span. We do have the ability to mitigate our risk of developing these chronic diseases. We do have a model, not only helping people to reach an ideal weight, but to optimize their life, reduce their risk of frailty as we become older, and really start to live a life where we thrive. The focus here is on gaining health. And when we follow our four components, we stay connected with our coach, we invest time in the Habits of Health system and these community calls and community events. We stay plugged in with our coach. We use the fuelings as tools. We really can make a difference, and we really can change the trajectory of our life as it relates to our overall health and well-being. So I just want to thank you both this evening, Dr. Garcia, Dr. Smith, for investing your time to share. It's inspiring to me to see physicians that are really moving into this new era of medicine where we're not even looking at prevention. We're looking at optimization, becoming the best version of ourselves. So thank you very much for that. We truly appreciate it. And next, we're going to have an opportunity next Thursday where Dr. Anderson is going to talk about the metabolic advantage and exploring coaching for healthcare professionals. So if you are a healthcare professional and you're here tonight and this is inspiring to you and you would like to explore what this might look like for yourself to help others, feel free to join us. And if you're not a healthcare professional, well, if you become a health coach, you will be one of those, a healthcare professional. So join us anyways and just explore what this would look like. Next Monday, we'll be back for another episode of Let's Talk. And this is really fun, party like a pro. Healthy holidays. I mean, we're about to head into October, right? We have Halloween, then we're going to go into Thanksgiving, then we're going to go into Christmas and Hanukkah and all the other holidays that come along this fall. So why don't we learn how to navigate these seasons like a pro so we can optimize our health? So it was great spending time with you. Remember, all of these are put onto our YouTube channel. They're on podcast. Feel free, all previous episodes there. If you missed the metabolic masterclass last week, go back and check that out. It was amazing. So thanks for joining us again tonight. It's an honor that we get to share this opportunity with you. And like Dr. A says, let's start with ourselves and get ourselves in America healthy. Have a great night, everyone.
Thank you.
Drugs.